Okay, guys, it is fine. Okay. So now we were talking about the characteristic features of a synovial joint. The first characteristic should be the lining, the surface, the cartilage who lines the two ends of the bone should be lined by hyaline type of cartilage. Are we good? The second characteristic, internally, the fibrous capsule should be lined by synovial membrane. And then it should be filled with the synovial fluid. If a joint have these three characteristics, the lining cartilage, hyaline variety, it should be, there we need to have a synovial membrane. Why we need a synovial membrane? For liberation of a fluid called synovial fluid. So these are the characteristics of a joint to be called as, these are the major criteria. We have major criteria and we have minor criteria. So this is a must. If a joint don't have all these three variants, then we have to change the name. Then we may use some other name. We will be talking about that. Now, let's start. So this was a generalized description. Fibrous joint, suture. What do you understand by the term suture? The place where my skull bones, they meet with each other. That's called suture. And it's a Latin word, which is derived from sutura, for joint. Calvaria is the skull cap. So there we find sutures. And then we had collagen, the ligaments which binds the two bones together. So these all are the characteristics. And these sutures, after 20 years of age, you can differentiate. Sometimes these lines, they disappear. So before fusion, there is a purpose, there is a function of this joint. It's really important. What is its importance? When we all born, when we were living in the uterus of our mothers, at that time, if we were born normally, when we passed through the birth canal of our mothers, our skull, these bones, they were not fused, so they overlap each other. They overlap each other at the time of childbirth, so the size of the skull has been decreased. One. Second, when a child is born, he's not intelligent. He takes time to identify. He takes time to learn things. So brain is growing rapidly. Brain is growing fast. So if the bones have been fused, and the brain grows in a super speed, and it attains its growth in a shorter time span. So till that time, the bones have not fused together. You might have seen certain people in this world. Their heads are so small, and they are mentally retarded because their skull bones were fused. And they didn't provide chance to their brains to grow, to reach to the full size. So that's why the brain stays small in a closed cavity. So these sutures, roughly till the age of 2 years, if you examine a newborn, you can see even certain pulsatile area with each breath that moves. And sometimes you might notice that doctors or nurse giving some type of injection from between this gap, the places where the sutures have not fused together. So we find two main, they are called fontanelles. And please be gentle. If you are fine, if it happens to you, you met a newborn, maybe few months old, just observe him or her very carefully. You can see his skull, on his scalp, something is pulsating. And you have to be very, because bone is not there. There's a gap between the bones. So these diamond shaped areas, they are called, the term used for them known as fontanelles. And these fontanelles are important. I told you the description and everything. The word molding means the skull bones overlap each other. So to decrease the size of the skull, because when we pass through the birth canal of our mothers, If the head was big, then our mother has to go through a cesarean section. A C-section has to be done if the head is big enough, so baby cannot pass. And those babies whose heads are bigger than their mothers have to undergo a surgery, a surgical procedure, a C-section. Anyways, so let's look at a calvaria. And I'm putting up different parts of it. You can see the suture line. And two bones, this is shown with green and red. So this is the place they meet some with each other. That's called a suture. And these are the skull bones. Two different bones, they're joining. And there are so many such unions. Are we fine? Then you can see that in reality. This is a drawing. And there you can see the different skull bones and very clearly shown in between. Can you see this diamond shape area? Called anterior fontanelle, posterior fontanelle. So this is how. This is a skull which belongs to an infant, a newborn, before the union of these fontanelles. Now, fibrous joints, another term. There are three types of fibrous joints. One is syndesmosis. Greek, joint and ligaments. Example, interosseous membrane. Where I find interosseous membrane? In my forearm, where radius and ulna. In my leg, tibia and fibula. There's a membrane in between which connects these two bones. Guys, this membrane is super strong. Even it is helpful in weight transmission. So, between my radius and ulna and between my, and then ligamentum flavum, where it is there, between the vertebral laminis, the parts of the vertebrae. Maybe this term is new to you. They are built for strength and flexibility, but we don't have too much movement. So now you can see this example. The two bones of the forearm, which has been shown to you, radius and ulna. Then you can see this. Can you see this? Striated lines? That's the interosseous membrane. And even this membrane is so strong, it is used for muscle attachment. It is used for weight transmission. Weight can be transmitted from one bone to other bone. Are we good? So, the second variant of fibrous joint, so that was syndesmosis. This is gomphosis. What is this gomphosis? Your tooth is being plugged in a socket, in a bony facet. So now, let's see it. This is one of our tooth. And it is in a bony socket. Let's see different parts of the tooth. This is my gingiva, gums. And then, in the bottom, it has neck, it has root. You must have heard when you're visiting your dentist, oh, I'm going for root canal and this and that. So that's the root thing. And then these are the ligaments. This is another example of fibrous joint. And this ligament has a name, periodontal ligament. So this is, we have seen the syndesmosis. This is gomphosis. Are we clear? They all are subtypes, different types of the same fibrous joint. Now, coming to the third, so in the fibrous joint, you have seen three things: suture, syndesmosis, and gomphosis. The example of suture was skull bones. The example of syndesmosis, your radius and ulna, tibia and fibula. And the example of gomphosis, all your teeth. Are we clear? Now let's talk about cartilaginous joint. We talk about cartilaginous joints, broadly two variants, primary and secondary. So now we use terms here, synchondrosis and symphysis. What are these? Let's see them. So primary cartilaginous joint, remember the binder, the structure which keeps this union, that is a hyaline cartilage. So epiphyseal growth plate, you remember when we were talking about a bone, I use a term epiphysis meet with the diaphysis, and there was an epiphyseal plate. That's one example of primary cartilaginous joint. Do you have movement in between the two ends of the bone? No. So this is an example of primary cartilaginous joint. It's a temporary joint designed for growth in length. We talk about this issue. how the bone grows, and once this is done, then we cannot attain more height. Are we clear about this? Now let's look at here. I'm showing you humerus again, and this is my epiphyseal plate between epiphysis and diaphysis. Which part of the diaphysis? The metaphysis. Are we clear? So this is an example of primary cartilaginous joint, and the cartilage here is hyaline cartilage. Clear? Now, so primary cartilaginous joint, we talk about it, we have seen an example. Costochondral joints. The word costa, rib and vertebrae, they join with this front chest bone, sternum. They make costochondral joint, occur between ribs and the costal cartilages. How my ribs join with this bone which is in the front of my chest, behind which my heart lives, that's the union between my rib and the sternum is through this costochondral cartilages, and this is primarily very little movement is occurring here. That's another example of primary cartilaginous joint. You can see here, you're looking at a rib cage, and then this whitish appearing thing are these cartilages. So these are my ribs, this is my sternum, and these white thing are costal cartilages. So the joint here, and they are made up of primarily hyaline variety. So this joint is another example of primary cartilaginous joint. I'm giving you so many examples, so if you forget one, you may survive with 2, 3, 4. Are we clear? So these red points are indicative of. So if there is someone has an injury, you have a head-on collision of your car, your chest collide with the steering of your car, you have severe pain, and this pain, you will not be breathing more because with each breath you had a pain, so you are not breathing properly. So this is an injury which may occur there, and it's a flexible part. So a severe type of pain comes. Now going to the secondary cartilaginous joint. What is the secondary? The characteristic is the primary cartilaginous joint, the binding force was hyaline cartilage, and here the binding force is fibrocartilage. That's the only difference. And then example is manubrosternal joint, the joint between the manubrium and the sternum. So my sternum, primarily it has three components. It has a manubrium part, it has a body part, and then it has a xiphoid process. So these three components, they join to make one sternum. So this joint, you can feel it here. We'll talk a lot about this joint when you will be in CVP block. So between the manubrium and the body of the sternum, let me show it to you. So now you can see it here, this place, between the manubrium and the body. This is the manubrium and that's the body. So this white line which is just in between, that's the example of this which has been colored red now. That's an example of secondary cartilaginous joint. And it is helpful when we'll be talking about in respiratory block about how the physiology, how the breathing occurs. This is one of the joint where we can have certain type of movement, but a limited, a restricted type of movement. Are we clear? So now, another example for my secondary cartilaginous joint. We all talk about, you all heard of this term, so and so have a slip disc. What is that disc? Between the two vertebrae. And when this disc slips out, person has severe pain, someone cannot walk even, that worse, and it needs physio and plus minus surgery. So what happens? When this disc slips out, the nerve which passes from here, that is being compressed between the two vertebrae, and that causes significant pain. Let's see how it happens. So let's take the nerves out of these, between the vertebral bodies. Now this disc slips out. When it slips out, this space decreases in size. And once it decreases in size, we encounter severe pain. How? It's been compressed. And then we have a classic pain. Disc issue will be presented with a pain. Patient will not come to you, doctor, I have a slip disc. Patient will come to you, doc, I have a severe pain. I cannot walk. And when you inquire, maybe there is a history of fall, there's a history of accident, some kind of trauma, some type of something went wrong. And after that, you have lifted something very heavy. And it may result in this injury. And primarily, the nerve roots has been compressed, and that results in all these things. Now, we talked about fibrous joint. We talk about cartilaginous joint. Under fibrous joint, we have three subtypes: suture, gomphosis, syndesmosis. Under cartilaginous joint, we talk about primary and secondary. I gave you example of primary, I gave you examples of secondary. Two examples for each. Now let's talk about a synovial joint. So most common variety, characteristics we talk about. I'm not repeating this slide again. Now let's see in reality. Two bones. I use the term, the surfaces are congruent to each other. They are made for each other. Now what is missing? We need to have a hyaline cartilage. Can you see this hyaline cartilage? A cartilage has been placed, so it minimizes the friction. So articulating surfaces. Now next, what do we need? They are covered with periosteum, all that. This is the capsule. It surrounds all, 3D type of thing. It surrounds all the sides. The two ends of the bone who are meeting with each other, it's all been covered. It's all been enclosed. That's my fibrous joint capsule. And can you see that? There is a blue thing which is emerging inside. That is the synovial membrane. And then this space is being filled with a fluid, which is called as synovial fluid. So we have all the characteristics. The bony surfaces congruent to each other, lined by hyaline cartilage, surrounded by fibrous capsule, internally lined by synovial membrane, and the cavity is filled by synovial fluid. That makes a joint to be called as a synovial joint. And what this joint is doing for me and you, it gives me freedom of movement, all the liberties. Then after having all that, this is a disc. If there is too much weight bearing, if there is too much pressure, if there is too much use, we may have this thing in between, and that's a disc in between. At places we call it, what do we call it? Meniscus. The term I use, meniscus, in my knee joint. Then muscles. They crosses over the joint, they bring the movements. And every living structure needs blood supply, drainage, nerves who are controlling. How much time left? Okay. So guys, this is what a synovial joint is. We talk about bursa. I will not be going in that again. Now, we have to classify the synovial joint. Synovial joint is not the one. Whose next lecture is? Guys, who's the next lecture? No lecture? Can I borrow 5 minutes? Otherwise, I can zip it up here. I'm done. It's your explanation. So guys, we can classify the synovial joint on different criteria. And this is how you have been shown within your upper limb. There are different joints and they have different names to them on the basis of their shape, on the basis of their movement criteria. So we have different criteria for classifying these joints. So let's take, what do you think? What has been shown up here? How these bony surfaces are. Guys, if you say wrong, nobody will penalize you. Learn to say wrong. If you don't say wrong today, how you will learn right tomorrow? How it look like to you? Flat, plain. So these two surfaces, they can slide on each other. Where I can find this type of joint in my body? Carpals, tarsals. Let's see them. You can see that it moves in, it glides in all the directions. And where I can find them? In my tarsals, in my carpals. So these cube-like bones, their in-between interaction, their in-between movement is just a sliding movement. So this is an example of plane gliding joint, and it's a subtype of a synovial joint. Second variant, what do you see in this image? A ball and a cup, a ball and a socket. So simple, ball and socket joint. There is no rocket science, only use your brain. Another image, this is my hip joint. So they are smooth, hemispherical, fits with each other. It's not like a baby wearing his grandpa's pajama. So what happens? So examples are shoulder joint, hip joint, and movements, multi-axial. You can go in each axis, and these are the only major joints of the body where we can have multi-axial type of movements, which includes all flexion, extension, circumflexion, abduction, adduction, everything. And these two joints are there. I know it's difficult if you and me try to bring circumflexion at our hip joint, but those who are practicing gymnastics, they can do it. Watch them if you want. Now, what's that? You saw this morning. What type of joint? Now we talk of, guys, there should be a difference. A talk of a doctor and a talk of paramedics. Doctor talks different. Any person, any layman can say it, yes, it's a bone. But you know it, it's a bone, it's a joint. What type of joint? What do you see here? Come on, don't you see ball and socket? Right? Now, more clarification. That was an MR image. This is the real dissection. And this is schematic. Are we aligned for everything? This is a shoulder joint. It is a classic example of ball and socket type of joint. Are we clear? Okay, condylar, ellipsoid. Think. Yes, wrist. Thank you. This is what ellipsoid. They are not ball and socket. They are a bit ovoid. They are elliptical in shape. Then oval convex surfaces. Where we find? At our wrist, metacarpophalangeal joints, at the base of the fingers. Not first, second, third, fourth, fifth. And they are, look at your wrist, what you can do? You can flex and extend. Flex, extend. Medial lateral deviation. Anything else you can do? So they move in either in this direction or in this direction. No other axis is being provided. So they are called biaxial. That's a functional classification. Biaxial. Now these condylar elliptical, you can see that your wrist. Lower end of this radius ulna and these carpal bones. And you can see that. Are we clear? Okay, going further. Saddle. When a term used saddle, what comes in your mind? Horse, Hassan. So, you want to ride. If you ride without a saddle, guess, any one of you interested in riding and all that? Experience of riding? So, ride without a saddle, see what happens. You may not even walk properly after spending few hours of riding. So this is how, this is you who's sitting on that. So there is a movement in multiple direction. So bones have an articular surface that is shaped like a saddle. Concave or convex. Then biaxial. So where? This is the schematic picture. Which joint of my body? My first carpo-metacarpal joint, thumb. That's an example of a saddle. One of the example. I have others. Hinge. Everybody knows what is hinge. Your door, it can open or close. If you have a fancy door, it may go up and down. Usually the car door, it opens like this, but some good cars, the door goes up and down. But normally we have, this is hinge. So let's explore hinge. So it can move in one direction. Examples, elbow joint. Example, knee joint, finger. But remember, knee joint is a subtype of hinge, but it's not a classic hinge. It's a modified hinge. Because functionally, they are monoaxial. Only you can open in one direction. But at knee, I have double movement. That's why it's an example for modified hinge. It has some variation. So hinge joint, you can see there at your elbow, temporomandibular joint, different places. Pivot. What do you understand by the word pivot? You remember merry-go-round? When you were a child, you visit with your parents some caravan or something like that, where for the kids there is some ride, they sit on horses and it goes round and round and round. So that's the example of pivot. So you rotate around a circle. A time when we cry for riding this merry-go-round thing. So this is how it is. So it moves in a fix in one plane. So bones spin in longitudinal axis. Where? In my elbow joint, I have a hinge type and also have a pivot type between the upper end of radius and lower end of humerus. Atlantoaxial. I'm saying no. I'm using this is another example of hinge pivot type. Saying yes is different. Saying no is different. Pronation, supination. Monoaxial. If you try to bring some more movement, you will damage it. So guys, the glitch was, if you go to my slides, which has been uploaded, I will change it, don't worry for that. But under the heading of pivot, I gave the description of hinge. So please swallow it. So you can see the head of the radius and the ulna where they articulate. And you can see that this is how they meet. And then we have a fibrous structure, a fibrous band which circles, which goes around with this thing. Are we clear? Guys, are we clear? Now, let's talk livers. What do you understand by the term liver? Weight. After that. So, to understand the action, the function, the performance of a muscle, we need to understand the livers. And primarily, we have three types of, guys, function is really important. And last MSK exam, I think 90% was function. So we all remember this. You remember this of your childhood, seesaw? And primarily, it has been exhibiting. So we have three classes of livers. First degree, second degree, and third degree. Guys, I'm not going in detail of liver. Just, I'm showing you something. Guys, there are certain slides which are just only to see. And there are certain slides which are there to read. So this is just to see and know this much. The proper detail of this will be seen in MSK. Don't worry for that. So categorically, these are different classes of liver. What are the examples? How it fits? Only here I have to introduce. You remember in the beginning I said this foundation block is a gallery walk. We'll take you through. Okay, this is what we have. And then we will learn, inshallah. Okay, summary. You talk about these joints, any issue? Any problem? No? Mashwar? So this is all what I said so far. Zabda, of all this 1 hour yield. Are we fine? I hope now you can figure it out that what is a joint? Three main type of joint, fibrous, cartilaginous, and synovial. Then synovial has so many subtypes. Are we clear? Thank you very much. 1 minute. Sana, now open up the thing. I have to answer the questions. Yeah. Yeah.
Okay. Most of it is like, do I need to know all of this? Okay, there's how the pivot functions. Where do we find the?
Okay, let me answer. Guys, one of the question which has been asked in the chat box, how the pivot function. Pivot, I told you merry-go-round, it moves around. It moves around and it goes round and round and round. That's how. And the example is, again, you'll find between the head of the radius and the notch of the ulna under the humerus, that's the place where we have a pivot type of joint. Second pivot in atlantoaxial joint. I think this is all.
Yeah.
Any other question?
Should we stick to the objectives and not dig in deep? I mean, in the slides and all that.
Guys, whatsoever has been shown to you, it's according to the objectives. Nothing is more than the objective. If you open the slide of the objective, it says classification, types, examples. Only I wrote 3 objectives. Doesn't mean I should write to 20 objectives, but this is the main broad basic objectives and stick to those. That's it. But this is minimally required. Are we clear? Thank you very much. Bye-bye. You're welcome.